So, good morning, everyone. My name is Maggie Dixon. I'm the Home Visiting Coordination Initiative Development Coordinator at Prevent Child Abuse New York, and I head up our webinar effort. So, we're so pleased that you can join us this morning. It's going to be looks to be a very interesting discussion and update and conversation. Just a couple housekeeping items before we get started. As the voice alerted you to, this meeting is being recorded. So it will live on our Home Visiting Coordination Initiative website and our dedicated YouTube channel. When I send up a follow-up email, I'll link to the recording in that email. Please remember to mute yourselves to eliminate distractions and keep the focus on our presenter for today. And there are closed captioning services available. So if you hover on the bottom of your screen over the closed captioning button and hit show subtitle, you'll be able to access those. So today we are so pleased to be joined this morning by Lisa Fainer, Director of Advocacy and Strategic Messaging at Parents as Teachers National Center. Lisa oversees the Parents as Teachers National and Federal Advocacy and is therefore looped in with the National Home Visiting Coalition. When we were planning our next few webinars, and by we I mean Jen and I, Jen's the director of the HVCI and she's on camera, she just waved. We wanted to give a more 30,000 foot kind of macro level zoom out of maternal, infant, and early childhood home visiting and policy work as we gear up for the next authorization and the next legislative session in New York State in January. So Lisa immediately popped into our heads. We've worked with her for years. She's a trusted partner, and we're so grateful that she's joining us this morning. So Lisa, I will go ahead and turn it over to you.
Thank you so much, Maggie. I really appreciate it. And Jen, really excited to be here. My name is Lisa Fainer, and I actually support some of the Home Visiting Coalition's work as a volunteer advocate. And I'm just really grateful this morning to be able to speak with the Coordination Initiative folks today. It's a really humbling opportunity, really, and I want to give a shout out to Prevent Child Abuse New York for their leadership on this initiative. Before we dive into the topic, I just want to share that, you know, I'm really dedicated to seeing our communities have a voice and get their voices heard. And so it's really a unique time in history for us to unite with families and with community leaders and really center our work around racial and economic equality and really helping us move the needle on the disproportionate access and outcomes that we see in families who face systemic barriers. So involving you as partners who are deeply and intimately familiar with the given needs of a community really can help make sure that we're putting forth policy solutions and suggestions and strategies that are going to help you the most. My everyday job, as Maggie said, is Director of Advocacy at Parents as Teachers National Center. In this role, I do support state and federal policy, and I've been there for almost 9 years, and I come to this work as someone who's had lived experiences, and those experiences drove me to become a professional advocate so that I can center families in decision making. And I spend a lot of my time educating others around how to step into their power and how to speak up when decisions are being made. And so I'm just so really fortunate to be here today with all of you who are doing just that. I'm going to go to the next slide. So if you could, please get your cell phones ready. Either open your text feature or a browser on your iPhone. And if I could get a couple of, I think you guys have the ability to give me thumbs ups or just go like this so I can know you're ready. And Maggie, I just want to make sure I'm coming through loud and clear.
Yes, you are. I can hear you great.
So the instructions are go to pollev.com, and they make me use my name as a login unless I pay money. So it's /Lisa Fainer 403. Or pull up a text and message 22333 and message Lisa Fainer 403 to that. And you'll get a confirmation email or text saying you're in.
So I'll give a little thumbs up. I'm in. I've got a text back.
Good. We'll go to the next slide, and as we get people in, we will just populate their responses. So let me know where you're calling in from, and you just click the map. And Maggie, can you give me a thumbs up that it worked for you?
One moment. I'm clicking on the. If I have a text, do I just click the?
I believe so.
Okay.
Oh, I see someone's from Dutchess Monroe. Great, it's working.
Yep, I've got it.
And you guys can see on the screen, it's populating with little green markers about where everyone is calling in from. So I'm glad that we have folks calling in from a variety of places. We'll just give folks another couple of seconds. How many folks do we have on the call? 19?
19 so far. This is cool. I like to see it live.
Yeah, it's fun. That's why I use this Poll Everywhere feature. And I like to ask where folks are from. I want to get to know the audience a little bit. So I think more people are trying. So I'm going to give folks just a few more seconds just so that they're ready, because we do have a couple more polls throughout, and I want to make sure everyone can participate. So
far we have Broome County, Monroe, Albany, that was me, Dutchess,
Bronx
City,
Westchester. And the way that it works, I think you click a region and it sort of puts you in a region. It may not be exact. So.
Oh, we've got our North Country folks, Clinton all the way up above.
Clinton County, great. Okay, well, we're gonna go to the next slide. And for those of you who are still trying, please keep trying, because the instructions are the same, but just a different survey. So this is just, what's your role? I wanna know who's on the line. This one seems to be easier for folks. Great. And I know that people don't like to be categorized, so if you're not on the screen, I'd love for you to type in the chat box who the other is, because I want to acknowledge that we don't have everybody fitting in a certain category, but this is a poll. So let us know who you are if you're not in one of these categories. And if you want to take a moment to just introduce yourself, your name and your location in the chat, that would be amazing.
We have one chat in, someone sharing that they are a family support specialist at Child Development Council in Ithaca.
Okay. Great. Okay, well, it looks like most of you are from the Backbone organizations and also are providers and advocates. So I'm so glad to see a nice mix of folks today. Whoops. So thank you so much for sharing a little bit about yourself. It really just helps me know who you are. Today, we're going to be discussing a little bit about the National Home Visiting Coalition, how it works, what we've been up to, and where we've come from, basically, and how you can join the coalition's efforts to reauthorize the maternal, infant, early childhood home visiting program. I think you have a really unique role to play as the reauthorization approaches in September. So the purpose of the Home Visiting Coalition is really to provide a peer network of organizations dedicated to promoting and expanding and continuing to improve home visiting. The National Home Visiting Coalition is comprised of home visiting models, national or early childhood health, education, and law enforcement advocates who have collectively together joined to advance home visiting as a strategy. And as you can see on the slide, these are some of the steering committee members, but there are about 90 other folks who are on the sort of outskirts who are participating in advocacy. But these are steering committee members. And you can see the website is listed on this page. So the coalition's work, the coalition's work is conducted through 4 main committees. It's very familiar to you all when you are joining groups, but there's a steering committee, a federal policy committee, the state and local engagement committee, and a communications committee. And the steering committee members really lead each of those remaining committees, and they meet every other week to discuss developments on Capitol Hill, in the field, and any relevant updates from the three committees. The Home Visiting Committee really conducts the policy formation, the policy analysis, congressional education and outreach, and of course, helping motivate and get the grassroots efforts going in the states. In past years, the Home Visiting Coalition was funded by a grant to support a facilitator of this work and to cover the costs of strategic press and advocacy. However, this year, it's important to note that we operate fully voluntarily. So we continue to seek support of a strategic funder so that we can be present under the dome and in the states. And for now, that means the coalition is lean and very intentional, but that's not news to any of you because we know this work typically goes that way. We remain committed to work together as organizations and models to put forth common definitions, unified asks, joint resources, and common branding. We do this so that we have a really strong, cohesive, collaborative voice on Capitol Hill and in districts. Now for a little history lesson and a quiz. Get your cell phones out. If you could, tell me what you think the answer to this question is. The Federal Home Visiting Bill, introduced in Congress the first time in 2004, was not the Maternal Infant Early Childhood Home Visiting Program, or MCV. It was titled, and if you don't know the answer, that's okay, just give your best guess. Okay, we only have 4 results. I'd love to see more of you participate. And a couple more. No cheating with Google.
This is tricky. I feel like I should know this.
Okay. Get a couple more results. So it looks like you guys think it was the Education Begins at Home Act, and then in second place, or rather runner-up, is the Home Visiting School Readiness Act. And actually, the Education Begins at Home Act was the first bill introduced in Congress in 2004 by U.S. Senator Kit Bond of Missouri. This legislation sought to authorize a standalone home visiting program for the first time and would have directed Department of Education, Health, and Human Services to collaboratively award and support home visiting. It would be interesting if it would have happened that way, if education departments would have been involved. And I clearly remember this because at the time I was working in the US Senate, and I remember being from Missouri and having this bill pop up and being really excited about it. Following the Education Begins at Home Act in 2008, a pilot project was funded by the Bush administration. Because Kit Bond was a conservative Republican, he had the ear of the White House and was very the Bush administration was supportive of funding this pilot project. And it really led to the creation and enactment and motivation to include what we now know as MCV in 2010 in the Affordable Care Act. And it was authorized at $1.5 billion for 5 years. And this was accomplished, if you recall, during the second year of the Obama administration. The Home Visiting Coalition has actively shaped federal policy and helped secure dedicated federal funding for home visiting since then. We're fortunate, due to very strategic advocacy efforts, that it's a bipartisan issue and everyone likes it. And we can't forget in 2014, which was the year I started working at Parents as Teachers, we had a 1-year reauthorization through the Protecting Access to Medicare Act, and we called that the doc fix for those of you who were involved in that reauthorization. And you may or may not remember that approximately from 2010 to 2015, the Pew Charitable Trust was the convener of the coalition through the home visiting campaign. And this coalition led efforts to extend funding for MCV in 2014 and 2015, resulting in MCV's funding extension of $400 million per year through September 2017. A revised home visiting coalition worked on the reauthorization after 2017, including a reauthorization in 18 with first focus offering up my good friend Karen Howard as a facilitator. And now the volunteer-based coalition of national advocates, which is the newest iteration of the coalition, was able to secure additional flexibilities and resources in the COVID relief bills, which we will talk about more in a few slides. And as of today, we're a year out from the next expiration date. MCV must be reauthorized by September 30, 2022. And I do have citations for this background. There's a couple of resources that I got this from. So if anybody wants it, there's a CRS report, which is Congressional Research Service report, and I think a Child Trends report that sort of documents the history of the legislation. I'm going to pause here. That's a lot. And if you are not a policy person, you don't have to know all of this. I just wanted to give you a background because we've done a lot of work together and we have come a long way. Home visiting is not something that just was invented by Congress last week, right? We've been doing this for 30 years. Governors and states funded it before the federal government did. And this is a big deal to start a new program like this. So just wanted to sort of encompass it in a bigger picture. So we have another poll, and I hope we can, all 19 of us, participate. I'd like to know, what are some of the emergency needs your programs or families had during the height of the pandemic? And it doesn't matter if you were a home visiting program or a housing program or some other community provider. Basic needs was really popular. Rent formula, support, emotional support, yes. And we continue to see this, right? It's not over. We thought it was, boy, it was so close, wasn't it? So you can see some common themes here. And this was really common among the field. And so what we did at the National Home Visiting Coalition is we immediately pivoted, right? The models got together, they started a rapid response, they started supporting the field's pivot to virtual home visiting, trying to strategically support them in telehealth, which really had been tested, but not really functional across the board. And so you guys did an amazing job. We are just continue to remain just in awe of the sort of leadership and support that you all provided to families during the pandemic. So as the real experts in the field, you already know that it was really hard to pivot, and thank you for your hard work. I really appreciate it. One of the things that we did as a part of the Home Visiting Coalition is launched what I personally branded and dubbed the Home Visiting is Essential campaign. The advocacy campaign went on for more than a year before we achieved our legislative goals. And we had a day of action, we had a letter writing campaign, we had cohesive messaging and graphics, and we did our first Hill visits virtually to talk with members of Congress about home visiting specifically and the needs of our families during the pandemic. And during December, the Coronavirus Response and Relief Supplemental Appropriation Act was passed into law. And if you guys hear some coughing, I have a little puppy who has this weird coughing thing that he does. And it was the first measure that Congress took up in relation to home visiting during the pandemic. And what it accomplished for us was that it gave us flexibilities to federally fund virtual home visiting. It allowed virtual visits. It told states that they didn't have to reduce staffing if we saw a decrease in enrollment. And it allowed states to use their MCV funds to purchase the needs that families had. There was no money attached to this one, which is, you know, always the catch in Congress. So more recently in March, the American Rescue Plan was passed into law, and I'm going to pick up my puppy so he doesn't have a heart attack. Come here. If he
I'm
lets me.
excited to see the mascot. I want to meet the puppy.
Well, he's running away from me right now. He just gets excited and he does this weird thing. And all of you know that we're all at home, so I don't have a kid, I have a dog. But more recently, on March 11th, the American Rescue Plan was passed into law, and it provided funding in the amount of $150 million in supplemental MCV dollars. And this money can be spent through September 2020. The law says that entities already conducting home visiting through MCV are eligible to receive the supplementary funding as long as they don't reduce funding or staffing for programs, that they have to coordinate with diaper banks, and that they reaffirm their focus on the priority populations for the period between the American Rescue Plan enactment and the second fiscal year after funds are awarded. And these funds really had some specific identified purposes in the legislation, and they were one-time funds to help cover virtual visits, in-home visits, staffing, and various administrative costs, including hazard pay, which we're seeing some states use, which I really love because our home visitors deserve to be paid like high quality professionals, and also the provision of other assistance, including grocery cards, which is kind of remarkable, right, for this Congress. So what's next? Well, as I said before, the law expires on September 30th, and it has to be reauthorized to keep going. Currently, it's funded at $400 million a year, and it's subject to what they call sequestration. Basically, they just take a little bit to hold back the funds in order to not exceed like the overall federal budget caps. And that's about $24 million across all states. So I'm not sure how much sequestration impacts New York, but I'm sure it's a slight touch for every state. In April, the Home Visiting Coalition convened about 45 national organizations to sort of get the motor running on advocacy. Excuse me. And we do have plans to start engaging state and local advocates. This is a perfect example of how we do this, to bring them up to speed on the strategy and the ask. In June, the coalition presented to the Start Early Community of Practice, which is a policy group of advocates from across the United States. And we met with key administration officials and staff of key leadership on the Hill for initial conversations and input, right? Because really they drive the bus, we get to hop on. And the Home Visiting Coalition is looking to provide priorities to Congress for the next reauthorization, so our champions can introduce a bill as early as possible. We want to avoid a lapse like we experienced in the last reauthorization, where we had a couple of months where we were expired. The field has agreed, the coalition and the policy folks have agreed to request a reauthorization for 5 years at $200 million for each year over, a $200 million increase over what we existing funds are over 5 years, which would bring the total program to about $1.4 billion annually over 5 years. It would double the tribal set aside from 3% to 6%. So essentially this would double MCV. So every state would get double what they get now. It sounds really good, right? The policy committee is examining what's working and what could be improved through legislation. The Home Visiting Coalition is in discussion about other topics, including virtual home visiting, providing a channel for other home visiting models to gather evidence and maybe become MCV eligible, and other ways to improve program equity and access for more families. The Ways and Means Committee has indicated already that they would like to hold an oversight hearing next spring, and timing will really depend on what are other pressing issues before Congress. And right now we know that we have the infrastructure bill that was just voted on, and we have a pandemic that is beginning to roar its head again. And so this next year, really, for folks like us who have worked on the Hill, we feel like we have a good year under our belt to know how to function in this environment. So that's not a bad thing, but it will be an interesting year for sure. So now that comes to you. You're like, well, what are you talking to us for? Well, you guys are one of the most important and essential parts of the work that we do as a National Home Visiting Coalition. National means we have national partners, but we have state partners too. Because at the end of the day, it's you all who know the programs and you do the work. Statewide advocacy partners such as the Children's Agenda and Schuyler Center will be engaged again for this reauthorization. And I'm sure partners like PCA New Jersey will support, you know, Healthy Families America. And I really encourage all of you to make sure those statewide advocates are connected to you, and you are calling in and participating in their opportunities for strategic grassroots mobilization. And it's really an opportunity for us to think about, you know, what happens with MCV in the future. There is a way for us to join the mailing list, and I'm going to circulate these slides after, so you all will be able to go on the slides and click this link, and it will let you sign up through a Google Docs. We will be providing action alerts. You probably will see them come out from the models, NFP, PAT. We have the big, we have some of that technology already, and we'll just send it from our own communities, but please participate in all of them. It doesn't matter which one they're coming from. We just need someone to send a letter to Congress usually. And we do plan to engage the field in really meaningful quarterly webinars with folks like myself and other national models, folks like Marissa Morabito from Prevent Child Abuse America, and our folks from Nurse Family Partnership, and others in the state to really strategically execute sort of this statewide grassroots campaign. So what does that look like? I'm seeing something in the chat. So we need your help. And the help that we need the most is to educate your entire delegation about home visiting. There's been a lot of turnover in Congress. There's a lot of new members. And then there's members who just need a refresher, right? Because they've been bombarded with a lot of responsibilities too. And to focus really on key targets and members and key committees and chamber leadership. And in your state, it looks like this. So I'm highlighting and glowing Mr. Schumer, not for any partisan reasons, but because he could almost be the most important single person in Congress for MCV, and he just so happens to be your senator. Again, since our last reauthorization, there's been significant turnover on House Ways and Means, and really to a lesser extent on Senate Finance. In addition, there's a committee called Energy and Commerce in the House, and they have like partial secondary jurisdiction over MCV, which is a little confusing, but it just means that they need to be educated as well. So I highlighted the members in your delegation. So this is all of the New York representatives and senators, and the ones that are highlighted are either on the Senate Finance Committee, or in this case, Chuck Schumer is leadership. He used to be on the Senate Finance Committee, or on the Senate Ways and Means Committee or Energy and Commerce. So the highlighted folks are our special targets, like they absolutely need several touches and education, but we need to do a touch on every single member in New York State. Just to make sure I didn't forget anything. Oh, fun fact. A majority leader, which is what Chuck Schumer does in the Senate, are really in positions to act as a clearinghouse for their respective party membership. as the status of legislation, and they secure cooperation and unity in carrying out the party's legislative agenda. And that just means whatever they think is most important, right? The majority leader remains in constant touch with the chairman of various standing committees, such as Senate Finance, to keep posted on the progress of certain legislative priorities. Meetings are regularly held between the leaders and senators to solve any conflicts that might arise. And this Congress, Senator Wyden is the chairman of the Senate Finance Committee as a Democrat, and Senator Crapo, who is a very good friend of the Home Visiting Coalition, is the Republican ranking member, and that is a good thing. We have a lot of work to do across the chambers in terms of general awareness, even though we have our champions. So this really means that here in New York, we're going to have really specific outreach. So please stay tuned for opportunities about how we can speak in a unified voice about home visiting, with a special emphasis on these target members. Just to refresh, Tonko is on House Energy and Commerce, Clark is on House Energy and Commerce, Rice is on Energy and Commerce, Higgins is on Ways and Means, and Sozi, I don't know if I'm saying these right, Sozi is on House Ways and Means, and Reed is on Ways and Means. Of course, Schumer's the leader. So this is not part of the Home Visiting Coalition. This was something that I put together because I have been involved in New York State advocacy for many years. And so I've sort of been along for the ride and observed sort of like what's been going on. And the state recently did a needs assessment. McVee legislation required that every 10 years the state says, oh, we got to look at the community and see what's going on there. And so they conducted a really in-depth needs assessment to look at poverty and race and access and all these issues. And it was conducted by the health department and researchers there. And in that assessment, a few things rose to the top in terms of needs and gaps and opportunities. It identified areas where really there remains the most interest in where we should focus in terms of what happens with McVee in the state. And that included the ability to enroll parents and caregivers pre-K, and this is directly out of the needs assessment, just so you guys know. Families with multiple children, currently those families can't receive services. Offering a program that has group connections was identified. Enhancing cultural and linguistic responsive services and providers, of course. A deepened approach on parenting, education, and support, and systems building. And sometimes that looks like data coordination and things like that. So a couple of suggestions, just as an advocate, I was thinking, okay, so what are some of the other things that we can do besides, you know, hang on to what the Home Visiting Coalition says? But really, I think as we gear up for reauthorization and even more for state investment in home visiting, I think your group should choose an unbiased, non-model representative to really choose to represent you on the Home Visiting Coalition. I encourage you to take it back and discuss it with your groups. Currently, the main voice for home visiting advocacy in the state of New York is led by the Schuyler Center, who provides sort of that non-biased representative stakeholder group and convenes us, and then model representatives and community stakeholders meet and they talk about advocacy. And I also encourage our stakeholders to seek out conversations with Department of Health and Office of Children and Families to explore what McVee can accomplish for New York if more money is available. McVee started 10 years ago and we've learned a lot, but we have a lot of gaps to fill, as we saw in the needs assessment, and it specifically points us to where we need to place new resources if they become available. And of course, you know, I put this down because I feel like this needs to be on every slide, but we need to really keep equity in mind. If McVee is doubled, McVee already prioritizes populations for a reason, right? We need to make sure that we're keeping those priority populations at the center of our work and making sure that our community leaders are aware of the needs in your community. And remember, state plans for McVee are amendable. So if we get double the money through McVee, again, hoping, right? Dreaming, wishing, we can really dream of anything we want, but it's up to us as advocates and stakeholders to really explain to our state legislature and our agency leadership what it is that your community needs. And so I encourage you to take this information to your agency leaders and get on the horn with commissioners and tell them what you need in terms of home visiting in your community if we are able to double MCPHE. And those conversations really start now, right? We're a year away. And what happens is, if something happens legislatively, states start to scramble and they put out RFPs. And if they haven't had these conversations, which most of them have, right? They don't know what you think. And so it's sort of a long game, right? Start now, get on their agenda, have conversations, even if it's just dreaming and thinking. It's not a bad thing to do. So I have another poll for you all, and then we will wrap. And I really appreciate you guys listening to me talk so much. And I'm hoping to open up for questions. I think Jen and Maggie are going to help lead us in that part of this the discussion, and we can try to answer any questions or just have a conversation really about what's going on your coalition. What are the different work groups up to? How does this, what we just presented today, align with what the work groups are up to? I love this because people can see them populating. Policy history, your role in advocacy, how we can make a difference. And if you are having troubles with the chat, drop it in the chat box and we'll go there. Strategic targets for advocacy, good. Next steps, good. We'll give folks just another opportunity to join here, because I think we're going to have probably somewhat of a discussion. I'd love to hear your questions, or just have Maggie and Jen facilitate that.
Absolutely. And I'm looking at the participant list and I see a couple of our partners and BBOs. So I really encourage you to use this time to just ask any questions that you have, or to talk about how your community work and your role in the HVCI kind of interplay, and what you're thinking in terms of next steps, as we see here.
And if you could, I'm going to go to the next slide, but this is still an active poll. So if you can participate, I'd love to get your feedback, because that helps us take information back to the Home Visiting Coalition to let them know what resonated with you the most and what to focus on during any other state presentation. So thank you for that. Oh, thank you. Really appreciate this opportunity. Again, I don't sit on the steering committee. We have someone who works for us that does that. But I do focus on state work, and I'm really been involved in New York, and I'm committed to making sure that, you know, prevent child abuse and HFA and you know, all of the other home visiting models, and the representatives and the advocates are all working together strategically with one voice to really, really work together on this next reauthorization. Reauthorizing a federal bill is no easy task. And 5 lobbyists on the Home Visiting Coalition in DC can't do it by themselves. We absolutely need you and your support. And so we are just so grateful for your energy, your voice, and I will turn it over to you all to help with questions. Thank you.
Thank you so very much, Lisa. This was comprehensive and certainly got me excited, just kind of thinking through strategy and our role, as everybody was saying, kind of filling in my role as an advocate and what strategic targets to kind of be thinking about. And I love that you included a slide about possible actions with the HVCI group, because we have convened once. We have a subcommittee on advocacy and just kind of the role that community organizations play, you know, locally and then statewide. And then, as I said in the beginning, this federal kind of 30,000 foot is what's hanging over everything, kind of the umbrella. But we're talking through, especially with the ARPA MCV supplemental appropriations, kind of that extra money, in addition to the allocation that happens to New York State, what counties can do to really intentionally leverage the supplemental. So I had actually wondered if, because at the moment, Prevent Child Abuse New York is planning on circulating just kind of a general letter with sign-on from our BBOs, with encouragement to just really take advantage of the supplemental appropriations. But I don't know if you can speak to local ways or specifics of how that MCV supplement could be used, by counties to really ramp up home visiting.
Yeah, it's really interesting. I've seen a couple of states using home visiting for different things. I know Connecticut has decided to invest in using their state dollars. This is not the MCV dollars, but using some of their relief money to work on a universal home visiting program, which would give moms like a one visit touch right after birth. And then in South Carolina, the state has decided through the Department of Education to use ARPA funds to expand parents as teachers, and I think parent-child home. They already have those programs and they're going to expand those programs, but through the Department of Education, which is amazing, right? And there was one other state that just did something that was really amazing.
New Jersey, I believe, also implemented a Family Connects universal model. And I was going to ask you, in Connecticut, is that universal? Is that nurses?
You know what? I don't know the details of it or how it's going to be how it looks. I think it's going to look very different in every state. I'm not really sure.
Okay.
So there's some basic questions in the chat about, like, what if I don't have a contact in Congress, right? I get it. I know where you're coming from. Or if you've never advocated on the national level, how do you take action? And we're going to do some more in-depth trainings, I think, and really outline with toolkits and messaging and resources like we did during the last reauthorization to really not script you, but really just make it easy to prepare. And just to be clear, the statewide advocacy organizations like Skylar and Children's Agenda and even Prevent Child Abuse really are the place where we feel like they can provide some strategic partners for you to help you understand who your targets are, and maybe even think about how do we coordinate amongst others in the state so that we're not like all bombarding somebody with meetings, but that we're doing it cohesively and strategically. So connect with your local advocates to help get in touch with your congressional offices. And you can actually start by asking your advisory committee or your members, or even your board members at your agency, if they have a connection to someone in a congressional office. It's likely that some of those power players have a number to some staffer in an office somewhere. And that's usually the first place to go. If you don't have someone on your board or your advisory committee, just do your homework. You download these slides, you click on the link of the target member, and it will go to their webpage online. And usually there's a place where you can scroll and request a meeting. And so I encourage you to seek out a little bit of resources before you request a meeting so you understand sort of what you have to plan and how long in advance and all of those. And we do trainings on this all the time. So once you go to their website, you request a meeting, and usually it goes to the main scheduler in the whatever state office they're in. So if it's for a senator, senators have offices all over the state. And so usually what they'll do is identify the office that's closest to you, and they will try to find a staff person to meet with you. And that's okay, even if the member of Congress isn't there, because it's the staff members who really support members of Congress. And so don't underestimate the power of a staffer. They have a lot of influence, and they're very, very important. And also keep an eye out for action alerts. You can simply participate in a 5-minute thing where you plug in your name and your phone number, and you simply send a letter. You can put links to that action alert in your newsletter. There's a question about, is it hard? Jen, you are a very experienced advocate. I would love to hear your take on that.
It's not hard. We talk all the time about it. It can be intimidating. It seems like it should be hard. These are important people, right? And they seem like they're far away and they're doing important things. But honestly, you are the expert. You know home visiting. You know the parents you work with. If you are a parent, you know your own personal experience. So they should be looking to you for information. I would say it's with modern technology, it's much easier than it used to be. You can click here and take action very quickly. So we will make sure to get you whatever resources Lisa gets to us, and we will continue to share things as we move forward with this. But it is not difficult. It's actually a lot of fun.
And I will also say, and I know Jen can speak to this, but I do not underestimate the power of Twitter, like tweeting at these folks and just kind of keeping that constant engagement on all social media fronts, I think is a whole new era of advocacy. Oh, Lisa, you're muted.
Sorry, I'm muted. I had to get a charging wire away from my puppy. It started, I remember back probably during the 2008 election, where social media started to boom in advocacy, specifically in campaigns. We're not talking about campaigns right now, but over the last 10 years or so, it's become a respected place to hear the voices of the community. And it took a long time for us to make that case for what I'm going to call old timer advocates who were like, Twitter doesn't matter. It does matter a lot. It's not the most important thing, but you will see from the Home Visiting Coalition, days of action and graphics that we branded and opportunities for you to use your own strategic messaging and hashtags and tagging your member of Congress. And it's your personal story. It's your personal graphics. It's your personal links to articles in the newspaper and op-eds that are going to be the most impactful with Charles Schumer and the other members of the key committees. Your stories are really important. The family stories are really important. And so I would encourage you, as an action step for now, would be to go back to your organization and get with your comms people, because they're your story writers, and sit around the table and start collecting the stuff you already have, right? Because this isn't going to be about, the most of these meetings aren't going to be about the policy details until the very end, right? What's going to be most important in the beginning is, what is home visiting? Who does it serve? Where is it not? What are the outcomes, right? And why does it matter to this member of Congress, right? And so again, we're going to offer you, through the models, through other advocacy organizations, a plethora of training opportunities. How do you meet with your member of Congress? How do you tell a story? We do these all year round, and they might not come from the Home Visiting Coalition, but they really go like this, right? They support each other. The work that you do in your state will help us do the work at the federal level. So I wondered if there was anyone on the call who wants to share if they've worked on any previous authorizations and how their experience was. If Maggie, I don't know if you have the opportunity to unmute anybody. We have a volunteer.
I'm looking. I think everybody has the ability to unmute themselves if they just want to hop in, or if they want to pop into the chat. We do have one more question that I want to ask.
Okay. No volunteers, that's okay.
But I do, so again, folks have the ability to just unmute freely. So if you do have something you want to share in response to Lisa's question, please do so. However, I do want to elevate, and I know you spoke a little bit to specific talking points and what resonates with people, Lisa, but we have a question in the chat asking if Parents as Teachers has any talking points that they found to be especially effective. And I know that Prenatal to 3, Pritzker, the National Collaborative for Infants and Toddlers, recently released a brief about lessons learned from messaging research. And I can put the link in the chat, but they kind of break down by policy influencers, by party, which issues resonate the most and which messaging, in terms of, is it brain development or is it equity or is it child poverty, like which lens resonates the most with people. So in terms, I don't know if you have any guidance or wisdom, specific to Parents as Teachers, that is really effective.
Sure. So strategic key messaging will be developed by the communications subcommittee at the Home Visiting Coalition, and those will be the talking points that we use. We'll try to avoid in the community, even though we want to lift up like certain programs in the community that are in a member's district or whatever, we'll want to use those common messages so that we're all speaking in the same terms. So if you meet with a legislator over here in this month and then somebody else meets with them that month, the messaging will be similar. I do think referencing comms research is helpful. I do think there are some policy groups that have their own agenda to move certain things. And so I would caution that certain policy groups might have tools and resources that want to move that agenda. And also, when it comes to Parents as Teachers, we offer up a lot of strategic messaging toolkits, but we would say talk about the new research. We have so much new research on child abuse prevention and literally changing the DNA of families. And that's a strong case to make for anyone. I think under this Congress in particular, where you have Democrats leading the majority in both chambers, it's not going to be a hard case to make for home visiting. But that doesn't mean that we don't need to shy away from some of our traditional messages around the evidence, the business case, the investment, why this matters for our workforce, the traditional sort of strategic messages that have worked in the past. And I know that what's that messaging organization, Jen, that has done so much work on this before, on early childhood messaging?
I'm not sure.
Is it National Collaborative for Infants and Toddlers?
No, they did one a long time ago, but really it's the iterations of that have evolved over time. And it's these messages that resonate with conservative policymakers, because we can't pass laws unless we work together, right? And so we have got to make sure that we have messaging that resonates with a variety of folks on the Hill who have different interests and priorities. So, and that is the approach of the Home Visiting Coalition, is to remain nonpartisan. And so we have done some strategic messaging trainings before, and so I will try to link to some of those that you guys can pass on. I do want to say, I know that many of you say, oh, she's from PAT, we don't want to, oh, Council for Strong America, yes, they have amazing messaging and reports and stories, and we work with them all the time at the coalition. When we offer training for advocacy at our home visiting model, it's not really necessarily just for us, it's for anyone in the field. And we offer materials that are for our program specifically. But you can take those materials and make them your own, okay? Advocacy is free. And so I want to invite you all to think about how to do that. But the Home Visiting Coalition will be providing really strategic messaging for all of us to use in a cohesive way. So I want us to stick to using those resources if we can.
Absolutely. Well, thank you very much, Lisa. So you mentioned wonderful resources, and I will reach out to you just because I'm interested in the congressional research report and the child trends report. So maybe we can start up a thread, and I'll get those resources and include a copy of Lisa's slides, a link to the recording, and again, that survey link to help us with our feedback as part of the PDG Birth Through 5 grant. So again, I would just love to thank Lisa so much for this opportunity. And I do think the information, we're getting some thank yous and comments in the chat about how helpful this was and how informative and lots to take. So thank you. And Jen, I don't know if you have any closing remarks, but I'll give everybody back a couple minutes in their day.
Thank you all. Thank you, Lisa, so much.
I'm so grateful to Prevent Child Abuse for bringing me to the table and for inviting the Home Visiting Coalition. And I know that all of you come from different areas of expertise. Not all of you are starting at the same place. So I hope that you can appreciate. I tried to make this as broad as possible. And I'm grateful for your time this afternoon. And thank you so much for the hard work on the.
Thank you, everyone. Have a great day.